Welcome to the Dispense Magazine podcast, bringing you news and information about medical cannabis for patients and physicians. Whatever you and your doctor might talk about, that's what we talk about here on this podcast. I'm your host, Sven Hosford. Right now, the Lieutenant Governor of Pennsylvania is on a listening tour to every county in the state, all 67 of them, to hear what people think about legalizing the recreational adult use of cannabis. In this episode, we get to hear from his wife, the Second Lady of Pennsylvania, Gisele Fetterman, about her thoughts on the subject. She's a part of an all-star panel that came together recently to discuss what happens to the medical cannabis program in Pennsylvania once adult use is legalized. We also hear from Representative Jake Wheatley, author of an adult use bill in the State House, along with Representative Ed Gainey, a staunch proponent, and Debbie Churgai, Deputy Director of Americans for Safe Access and an expert on state laws on recreational and medicinal cannabis use. Here's how it sounded on March 30th, 2019. Welcome, everybody. This is our first time we've added all this cannabis information onto our Mind-Body Holistic Healing Expo here in Monroeville, Pennsylvania. I'm really happy you could all show up today. I think we're going to have a really great conversation. We've got a very esteemed all-star cast of panel here. My name is Sven Hosford, and I am the publisher of Dispense Magazine. This is the first copy that just came out. We're in every dispensary in Pennsylvania, and we focus on the conversation that happens between the doctor and the patient. So we're most concerned with what do doctors and patients talk about, and been a part of helping get cannabis made legal for medicinal purposes here in Pennsylvania. So I'm very happy to be having this conversation today. First, let's introduce our panel. I'm really excited that you all are here. Thank you so much. Gisele Fetterman is an access and equity advocate. An access and equity advocate. We're going to get into a little bit about what that exactly means. She is a hugger, so beware if you're going to introduce yourself. She is the Second Lady of Pennsylvania. You may have seen her husband is on the listening tour right now, but we get to hear from her today. She's a founder of Free Store 15104, where surplus and donated goods are received and redistributed to neighbors in need, and that currently serves close to 1,600 clients a month. It's amazing work. She's also the co-founder of 412 Food Rescue, which is a community-wide effort to end hunger and reduce food waste. Thank you so much for being here.
Thank you. Thanks for having me.
We also have down on the end Representative Jake Wheatley, Democratic member of the Pennsylvania House of Representatives, serving in the 19th District, and he is the author of HB 50, which would allow adults to use cannabis legally in what we call the recreational mode. Representative Jake, thanks very much for being here.
Thank you for having me.
We have Representative Ed Gainey. He's a Democratic member of the Pennsylvania House of Representatives, and he's serving here in the Pittsburgh area in the 24th District since 2013. Thank you so much for being here.
Thank you.
And we have Debbie Churgai. She is the Deputy Director for Americans for Safe Access. It's a member-based organization working to ensure safe and legal access to cannabis for therapeutic uses and research. Americans for Safe Access works in partnership with local, state, and federal legislators to create policies that improve access to medical cannabis for both patients and researchers. Debbie has extensively studied the recreational and medicinal state programs, so she is our referee, our expert here on the topic today. So I think this is going to be a really interesting conversation because we're going to be talking about what happens to our medicinal program if our state goes full recreational. I think it's valuable to examine the existing medicinal use law and the program, and we'll also discuss the impact that recreational may have on our program. So we're going to look at things from all sides of the issue. If we have a medicinal program, why do we need recreational? If we have a recreational program, do we need medicinal? Or do we need them both? And if so, why? So we'll discuss the social justice impact of legislation, as well as some of the other legal issues around employment. And we'll discuss the medical aspects, especially the difference between cannabis used medicinally and recreationally. There is actually quite a difference between the two ways people use cannabis. And most importantly, how do we make sure that all residents of Pennsylvania have easy and affordable access to safe, legal medicine and perhaps cannabis for recreational use? So this is not a debate. We're not looking for people to take sides and start making signs and protests and everything. You probably get enough of that on the listening tour. But we want to have a serious and detailed conversation about just exactly what we should be glad about and concerned about as Pennsylvania looks like it inevitably will, moves towards legalization. So I think we can all agree that basically we're on a trajectory that at some point in some time in the near future, probably well within the next couple of years, Pennsylvania and maybe all the states are going to be recreational, legal. So if we start with that as the premise, then the question becomes what happens to our medicinal. So let's start with Representative Wheatley. Sir, can you outline basically the key aspects of HB 50?
Sure. So what HB 50 tries to do or proposes to do is create a separate chapter in Act 16, which is the Medical Marijuana Act, that's the law. We don't change anything in Act 16 right now except for the word marijuana. We changed it to cannabis. Then we create a whole new chapter under the law, which would make legal adult use, adult being 21 and above, where we try to incentivize utilization of Pennsylvania farms. We try to set out a tax structure for the new product. And one clear difference is right now, there is no tax on the medical marijuana, medical cannabis to the consumer, where we do have a tax to the consumer on the adult use component, which will make the price difference, which is an aspect we think for medical patients would still incentivize them using the dispensaries for the medical product, because it will be essentially it'll be cheaper.
So the plan is to have the medical side cheaper then?
Yes.
Yeah. Okay.
And our intention, and so we also have some social and criminal justice aspects in House Bill 50, which we think should be for the whole industry, both on the medical side as well as the adult use side. But essentially, it would any individual who was caught with marijuana in the past and may have lost a professional license or may have lost a driver's license would be returned to them automatically. If they happen to be in prison for solely a cannabis-related charge, they would be released. Their records would be expunged. So we have that component in there as well. And so we have some other aspects that are also in the bill around, again, the tax structure. I'm trying to remember, I've been talking about it so long. We have so many changes coming to HB 50 that I'm not sure what, sometimes it's difficult to remember what's in the bill and what we're proposing to be in the bill. But I think those are the major aspects of it.
And would the people who have the grow licenses and the dispensaries, would they just add on, or are we just keeping them as?
Yep, so what we offer is no one who has currently a license under the medical program can be refused a license as long as they meet all of the state standards, which presumably they would. They could then apply for adult use as well. So we do have components in that. We also have some aspects that we're talking about. It's not in the bill now, but there's some talk about offering up processors only licenses for adult use, where we're trying to incentivize smaller entrepreneurs to come into the industry, maybe to produce their own edibles and so on and so forth. Again, we're proposing edibles. Our intentions is to make edibles for adult use, and I'm assuming if it happens on the adult side, it probably will happen on the medical side as well. We're also talking about some type of delivery system. It's not in the bill yet, but we've been talking about that, and we've talked to the medical side as well, because we think either way, even if we don't go to adult use, we think having some type of delivery system might be beneficial to the medical side. Again, there's a lot of citizens that we've talked to who have voiced concerns about coming into the facilities from a standpoint of safety and security. So we've been talking about potentially, again, it's not in HB 50, but we're having conversations that even if HB 50 doesn't move, we need to do some things to our Act 16 that makes the medical side stronger, and so that is a component of it as well.
We have some draft legislative language on delivery if you want to take a look at it.
I certainly would love to take a look at it.
Excellent, excellent. Now, when we talk about this issue on the recreational side, obviously one of the biggest things that people want to know about is how are we going to repair the lives of those people who've been put in jail for this thing, which now a bunch of rich, mostly white folk are doing.
Sure.
What all is in the bill that's going to address that?
Currently in the bill, what's in the bill currently is just the expungement component, the return of their licenses. That's what's in the bill currently. What we've discussed since the bill has been introduced is the possibility of all marijuana, all cannabis-related charges. In our bill right now, it's dependent upon the weight component of our home grow program. So whatever is the potential final, in our bill, home grow, home cultivation, we have up to 6 plants, 3 flowering at any one time. There's been back and forth of what that amounts to as relates to weight. We've been talking to both advocates and other stakeholders about changing that in some form or fashion, maybe go to just a canopy size determination, like 10 by 10. But whatever that is in our bill would then be, if you were caught with something of that amount or less, then you would be automatically expunged, released from prison, records and all of that stuff, returned, licenses. What we are going to change it to is any conviction, once we make this law, any conviction, doesn't matter the weight or amount, as long as it didn't involve violence, would automatically be expunged. You wouldn't have to instigate anything. It would all be on the department to identify who those individuals are, expunge their records, return their licenses. We also want to take some verbiage, and we got that from Michigan, by the way. Michigan has that, and they also have that a cannabis-related conviction does not automatically prevent you from being in the program, meaning you can own or work in the field. We want to take that aspect of Michigan law and apply it to our law. So individuals who have been punished for maybe selling or growing can now come legally into the field and don't have to worry about it. And then we also are talking about some social justice, redistributing some of the money. Some of the money goes towards helping our medical patients. This is an aspect that we learned after we introduced. It's not in the bill now, but we will be. So some of our adult use money will be directed to help those individuals in the medical side, because they can't get insurance for it, to further reduce the price of it, because we do know some of our citizens who need the medicine can't get it because they can't afford it. And then some of it will go directing towards communities that have been over-policed on this issue. And so those are aspects that, from a social justice component, that we want to put into the bill moving forward.
Were there any other important aspects that you understand between recreational and medicinal use?
I mean, the home grow component is a major. I mean, it was fought to be into the medical side. It got negotiated out. Yeah. But I think the home cultivation part has some implications to medical, because I'm assuming some patients will, if we were to pass and have home grow in a bill for adult use, I'm assuming some medical patients might choose to do that, and depending upon the number of those, I mean, it could have some implications to medical, but that's also why we want to enhance medical side so that they can do deliveries, so they can if we can reduce some of the costs on the medical patients with some of the money from adult use, maybe that also allows some to come in that way. So we want to find other ways, because our intention is not to hamper our medical side. It's only to strengthen our medical side, but at the same time offer the plant to adults to make decisions for themselves.
Well, I know a whole lot of dispensary owners that are going to be happy to hear you say that you're looking to strengthen the medicinal program, so I thank you for that.
No doubt.
On their behalf. Let's move on to Mrs. Fetterman. So lovely to see you. I'm so glad you could make it today. Tell us what you are an advocate for in your introduction, I said.
Sure. Well, all of it, but I am a card holder. I was part of one of the first licenses that were issued. And so much of it has been the stigma, since coming forward with it. I'm a proud holder. In the last 30 years of my life, I don't have a memory where I'm not in pain. And this is something that has really helped my life. But I get all the time, well, you don't look like someone who would be using medical marijuana. So the stigma, I think, is something we really have to still do a lot of work on. But it's something that has improved the quality of my life tremendously. Pain is something that will make you go crazy. If you wake up and you're in pain every single day. I had a horse riding accident when I was 6. So every day of my life since I was 6, the past 30 years, I've been in pain.
Wow.
And I can't, to me it's really important to continue to strengthen that side as well. But also, how can we lead this effort with equity and see what all the other states have done wrong and do it right, get it right the first time.
Do you think Pennsylvania did that on the medicinal side? Do you think I've talked to Fulmer and Leach about this, and they both said they studied the other states' laws and really tried to do it right in Pennsylvania. Do you think they succeeded?
I think so. I think it's been a really good, smooth transition. There are still folks that are limited financially. So, how can we continue to improve access so that everyone can afford this? I think that's something we need to continue to look at.
And you think where you stand on the legalization is that this will enhance people's access?
Right, and leading in a way that we are making sure those who have been left behind out of this have a first opportunity at this. And that's really important to me.
I think you've already answered a couple of the questions I have about your experiences and your core motivations. Are there other aspects about the legalization that have you concerned about our medical side, or you're happy to see and you think it'll help strengthen the medical side?
I think it will. I can't put into words what it's like to walk in and describe what your pain is and have the bud tender help me find something that's going to address that exact pain. And I haven't had that experience with any doctor of any kind other than this. I can say, it feels like this, it looks like this, it's this, and they'll say, try this and this, and it helps. It helps so much.
And as someone who's participated once or twice in my life, I'm always astonished at how truly medicinal some of the effects are. You really do need this for pain.
Yeah.
So it's not just a front. I think a lot of people look at the medicinal side as just a front, a way to get their foot in the door for full legalization. In some cases they might be right, but I don't think in Pennsylvania that's true. The medicinal side is seriously medically oriented.
Yeah, I'm stopped by elderly or, everywhere I go. And, I had an old couple who said, I was really scared to try it because I don't want to be associated with that. But my kids made me do it, and it's changed my life. And we hear those stories constantly. And I think exposure is really important. And it's about those who are part of that program sharing their stories and getting those, well, you don't look like someone who would do this. And, maybe it can help me also.
Well, and I think that's really the key thing is the stigma, to reduce the stigma. Do you have any other efforts or plans or ideas about how we reduce that stigma?
I think it's continuing to share those stories, and those voices that are willing to share them help to amplify them, because I think people need to see that. And, when I'll share, I have chronic back pain, and you'll hear 10 people in the room say, oh, I do too. I didn't realize this could help me. So I think it's continuing sharing those stories, and that's what's going to help break that down. And exposure really will help. I've seen in the listening tour entering a room where, in the beginning you have all these folks that stand out and speak against it, and at the end of every session they raise their hands on who's pro and against, and you see those numbers change within that hour and a half with people sharing their stories, how it has helped them, how it has helped family members.
That's a story I hear a lot too about the children of elderly people get their parents to use it. That's a very common thing. Well, thank you for sharing all that. Let's get to Representative Gainey here. If if the bill passes and we become a legal state, what do you think is the most impactful thing that will happen to your constituents? How will their daily life change?
So I think for my constituents, if we legalize it, it definitely takes the stigma off of it. I think you're absolutely right when we talk about stigma and we talk about social justice. A lot of times, you know, I had a conversation, for instance, with Senator Balakovich when he was in office, and he said, you know, Ed, for small amounts of marijuana in my township, if we find somebody, we just take them home. I said, that must be nice. In my community, they go to jail. And so legalizing it automatically removes some of the barriers that have definitely had an impact on generation after generation of African Americans going to jail, 4 times more likely than my Caucasian counterparts. And when it comes to going to jail, we remove that. I think the other thing we have to do that'll help, that legalization will help, is for the nonviolent cases like Jake was talking about, when they come out of jail, they don't have a felony or a misdemeanor. I think that's critical. You know, I was sharing with somebody the other day, here go a guy, he got a professional job or he's a blue collar worker. He gets caught with marijuana and now his whole career is over. And we've destroyed a career instead of saying, hey, listen, you know, he's above 21, he should have a right to do what he wants to do. I think some of the other stigmas that we would remove from that is when you talk about the construction work, when you talk about the union part of it. I think education is important because, one, no one should go to work high. That's number one. Number two is, you know, you got to understand that if I'm not going to work high, I'm okay. You know, now what I do in my own spare time, that's what I do in my own spare time. But a lot of the stigmas, well, marijuana stays in your system for 3 weeks, right? So just because it stays in your system for 3 weeks don't mean you high for 3 weeks, right? So we got to be able to educate people on that. Like, you know, if you're doing construction, because I'm hearing this from some of my unions that, you know, if you're doing construction, we don't want nobody high next to us. Well, they're right. They shouldn't have nobody high next to them.
Right.
But the reality is they shouldn't go to work high. And if you're telling me, like, if somebody pulls you over in an accident and they give you a drug test, breathalyzer, whatever, and it says you got weed in your system, that don't mean I just smoke marijuana. You understand what I'm saying? Doesn't mean that. So we got a lot of the stigmas we have to take off.
Well, and this is a big problem, I think, within the whole industry is that, you know, different people have different tolerances. So somebody could have smoked a joint, you know, 2 weeks ago and they're not high anymore. Somebody else might need, you know, a really, really high dose for pain. And, you know, the next day they're not high, but they'll register off the charts if somebody does a blood test. You know, so finding some equity on the scientific side is
It's
really
critical,
a problem.
but legalization does that.
Yeah.
Legalization will remove those barriers. So you talking about legalization from that standpoint, that's why it's a positive. And that's what we're looking to do, legalize. I support Rep. Wheatley's bill 1,000%, but I also support the decriminalization bill. And the decriminalization bill, I think, is critical because you can't have every municipality having different laws when it comes to decrim, even in small amounts. I can be in Pittsburgh and go to Westmoreland, now the game is different. And so that's a detriment to society. And if we don't create a clear state law that talks about decrim at some level, then every township that we go in, every municipality is going to be different. I don't see no justice in that. I think justice is a statewide decrim bill. I have one, Wozniak has one, but the reason why I'm not saying his is bad, I will sign on to his too, whatever we get past the goal line. But for me, I don't think we need to talk penitentiary talk ever again. I don't think we should ever have that conversation, and I don't think we should have high fines that leave people in debt. I don't think that's the purpose. If that's the purpose, we're still not alleviating our citizens. What we're doing is continue to create barriers. As we create laws, we should be destroying barriers.
Yeah. Well, you talked a little bit about the construction industry. The Pennsylvania Manufacturers Association recently issued a public letter against legalization, and their argument was basically it's hard enough to find employees because so many balk at having to take the drug test to get a job. And they argue that these tests are essential to ensure the safety on hazardous jobs and conditions in the industry. So do they have a point, or will more people using cannabis further diminish the pool of available employees, or what do we do about that?
I think again we got to go back to education, right?
Yeah.
And that goes back to what I talked about a minute ago of saying I'm high on the job. I think when we discuss it from that point of view, let's talk about it. If I'm not high on the job, I'm not a threat to nobody. And some of it is just due to the lack of knowledge that they have in regards to cannabis. So that's why I said there has to be more education. You don't want nobody drunk on the job. You don't want nobody with prescription painkillers on the job. You don't want that. So no one is advocating for someone to be intoxicated or high on the job. But what we're saying is in their own spare time, then if that's what they want to do, then they should have a right to do that. If you get caught using on the drug like you do with alcohol or anything else, then that's policies to be able to be dealt with through that business, organization, or construction unit. But the reality is, just because I smoked on Monday don't mean I'm high on Thursday. And so we gotta be clear cut about that. And the other part, it's not just that, it's also probation. When you talk about probation, when we talk about legalization, right now a lot of people are going back to jail or have to have their probation expended just because they had marijuana in the system.
Right.
And so now it's a double whammy. Every time I go to probation, now I'm skipping probation. Now I'm missing meetings. At some level, we could do this right now. We can eliminate, and I'm working on a bill now that talks about from a probation standpoint that we eliminate marijuana as being one of the things that they test for.
That was my next
because
question.
At the end of the day, we have to be able to give people their lives back. We have destroyed generations and generations on something that, like I tell people all the time, people have been getting high since the beginning of time, so when is it gonna stop? So since we know that, let's make sure we creating laws that give people that opportunity, not put them in the penitentiary.
Did you want to amplify?
Yeah, I wanted to just go back to the manufacturers
Sure,
for a minute.
sure.
One of the things I would encourage them to do is maybe come to the table and sit with us as we draft our legislation. But we do know, even with the Medical Law Act 16 in place, employers in this Commonwealth, I think, have to kind of reconsider the work rules again. And there are employers who are now taking cannabis test off part of what they're testing for, primarily because they see this now moving in a direction that is a legal space similar to alcohol.
Yeah.
And because they are not trying to diminish the pool, they're trying to make work rules that will be inclusive of the new work environment. And I think that's what we have to do with our manufacturers. I think that's what we have to do with our labor and unions. This is a new era, and our work requirements and laws have to kind of follow. And so what should they look like is really the question. It shouldn't be, no, we're not against it, because that's hiding and trying to duck our head in the sand like this is going to go away. It's not going away. So since it's not going away, let's figure out the work environment and let's create rules that reflect what we're really trying to get to.
Talking about the unions, the Pittsburgh Firefighters Union recently negotiated a deal with the city. So any firefighter can take their MMJ card to the testing company, and under HIPAA rules, the testing company cannot report to the city that they have a card or any positive drug test. All the THC drug tests have to come back negative. Now, so do you see, come back to you, Representative Gainey, do you see that as something that more unions should pick up and run with that football?
It's great. That's positive.
Yeah.
Because, again, now you're talking about how you're creating new policies that, like Wheatley was saying, you create new policies that impact a new workforce development, right? So that's positive, because when you think about it from a firefighter, police, EMS, they see trauma all day long.
All day long.
They see
day.
trauma. They got post-traumatic stress, even if they don't know they got post-traumatic stress.
Almost everyone.
Because you can't go and see that type of level of drama every day. And that's why I think that one of the greatest initiatives that I've seen, and I've learned so much about it this year, is the Lieutenant Governor's listening tour. Because I've listened to two of them, and you're beginning to find out that a lot of people's belief, and this is why the firefighters, again, is so important, is that people's belief is based on fear, not knowledge. And as long as we allow people to live in fear, then they'll never get it. It's like what I tell people about deregulation all the time. There's a fact and there's the truth. the truth about deregulation is that since we've had a war on drugs, we've birthed more drugs on our streets, called fentanyl, ecstasy. We got more overdose, more homicides, more suicides. So for someone to tell me where deregulation has worked, I can't see it. The only thing I see in deregulation is led is more death. So at some level, if you want to change the game, you got to change your policies. What the firefighters are doing is unique in itself because they're setting a trend for other unions, for other city employees. So you're going to see that begin to multiply in other government agencies like the county, like the state, because if it's working for firefighters that run into a fire,
Right.
how can it not work everywhere else?
Right, and you got to think that firefighters have just as dangerous a job as anybody in construction.
I think their job may be a little bit more dangerous. I'm not trying to run into
If other
fire.
people's lives at stake too. Yeah.
That ain't something I wake up wanting to do, running the fires. I give them all the respect in the world.
Absolutely,
But it is
absolutely.
about policy, and someone had to be the first in order to say, we're going to take a leap of faith, step out to show you where we change the policy, and the policy works. And that's what probation should do by taking marijuana off the drug test list and giving people their lives back.
Yeah, yeah.
Yeah, education is such a big part of that. You know, I still hear that argument every single tour stop that it's a gateway drug, right? We're still having that conversation. And you think after all these years this has changed. It hasn't. That theory is still very much alive in these folks' heads.
Yep, yep.
And how can we continue to educate where we can begin to finally get away from that conversation?
And on that note, that's something that as a state we need to talk about as well, because there should be grants available through education to really begin to talk about the municipal marijuana, municipal cannabis and how it's worked and what are the real truths about it. Right now, that's the one thing from the state we should be doing, whether that's from a grant that we put together, but we need some educational grants to really discuss what, the whole truth behind marijuana and not leave it just for the fearmongers to be able to present some facts that are not true.
Yeah, yeah.
Well, and I don't know if we have it at our booth, but we have a one pager of what the FDA says about cannabis, and it clearly says, FDA says it is not a gateway drug.
Yeah, I like to
Send people to that website. I mean, yeah.
I'm gonna come get that.
Well, let's turn to you, Debbie. You're our referee here in the room. You're with a great organization in Washington, D.C., and you've looked at this issue. What impact does full legalization have on the medicinal industry, on the medical industry?
Well, unfortunately, what we're seeing in a lot of states is that when full legalization comes in, the patients are getting left behind. I like that you said the word separate when you were describing your bill, because it's really important to separate these two programs. They are very, very different. We're talking about patients who need large amounts of medicine, and they need it every day, some of them, and every day for the rest of their lives. They need certain types of medicines. So some of the legalization states it's hard to find their particular types of medicines, because some of the other medicines that are higher in THC might be more popular with the recreational market. So we need to make sure that there's still these protections for patients, that their medicine is protected. Maybe give them first priority or separate lines or tax deductions, things like that. It's hard for a mother of a pediatric patient to go into a recreational facility and talk to a bud tender who's going to say, hey, this makes me feel this way. That's not what a caregiver of a pediatric patient wants to hear. They want to hear from a doctor. So we also want to encourage doctors to be educated and have that patient-doctor relationship. I don't think legalization is the key to destigmatization. Education is the key, and educating doctors and continuing research. That's the key to destigmatizing this medicine. So I just want to make sure that when states do legalize, that they don't forget about patients and they don't push them on the back burner, and that they protect the doctor-patient relationship.
Have any states done it really well?
Massachusetts, actually, it's just starting, but Massachusetts has a lot of patient protections. And so I would look at the Massachusetts program for sure.
What are some of the key things that Massachusetts is doing that we should be doing?
They have priority for patients. They have lower cost for patients. They have I think they have the greater amounts that they're allowed to carry on them. And I think in the dispensaries, there's a priority for patients. So unfortunately, what we found in some other states is if you go into a dispensary that's both legalized and medical, they'll put the patients at the end of the line because you have to actually verify that they have a card and that they have a recommendation and all that. Where with recreational, you can just come to the front of the line, buy whatever you want. So I think it's important that patients get served first because they're the ones that are sitting there in pain and need the medicine. So Massachusetts seems to be doing it right so far.
One thing about Massachusetts I will say is, and we tried to do this when we did the medical marijuana, was their hardship program is probably one of the best hardship programs in the United States. I mean, it really makes it, when you talk about putting patients first, their hardship program is excellent at helping people who may not be able to afford it to be able to receive the type of municipal care they need to deal with what they're dealing with.
And I was going to just add, we are working on making sure that we are prioritizing the medical side. So, for example, we envision when adult use come on, that you will have separate lines for receiving product, that for the growers, the medicine goes first, it's prioritized. So just for the production of it, it's prioritized. And again, we're trying to look at ways to support those patients on the medical side with revenue to help lessen the cost. So we're not taxing it, but we're also looking to subsidize it with adult use.
Yeah, and I love the idea of the adult use market giving back to the medical market and helping them with reduced costs or car rides, things like that. But also, I would also recommend on whoever is overseeing the adult use program to have a patient and a medical professional on the advisory board, just so you can hear their issues, because you're not going to know those. As an adult use market, you're not going to know the patient or medical professional issues unless you have someone there.
Thank you.
Well, we've seen California started 20 years ago, just as a Wild West kind of thing, and I think most people agree that the medicinal label that they put on it was just a thin veneer to allow people to use it recreationally. So Californians have a whole different aspect of moving now into full legalization. In Pennsylvania, we started from zero, from scratch, and we started a very structured, very regimented, very controlled, truly medicinal program. Can you do a little compare and contrast about which you think has had the most effect and impact on patients?
Well, California is a really interesting state because it's not just a state-run program, it's different per county. So it really depends on what county you're in, and California is where we actually hear the most complaints from people because, and they complain about the smallest little things, but like taxes, they're complaining a lot about taxes. I mean, access is not a problem. Access is not the problem in California. But where you live really depends on how much you're going to pay, or but I mean, because access is so not a problem, a lot of people are just kind of using medicinally. They use the adult use market for medicinal purposes.
Right.
But like I said, we really want to encourage that doctor-patient relationship. And so I think Pennsylvania has the opportunity to do that, especially with the research and everything that's going on here. I think that encouraging patients to talk to their doctors and not just to get advice from a bud tender is really important.
Yeah. Right. We have over 1,000 doctors who've signed up in Pennsylvania.
Whoa.
You didn't know that?
No, that's amazing.
I thought so too. That really is the biggest thing that can help destigmatize,
Absolutely.
right? When doctors initiate that conversation with the patient.
That's amazing.
I think universities.
Right.
Universities play a part too. I think the Act 120 speaks to that. I think when you talk about the research that we're continuing to research, just how powerful this plan is and how it can be used from a municipal service to be able to help other patients that have illnesses. I don't think we've scratched the surface. I think when we continue to drill down on this research, you're going to find it where it can help on a whole lot of areas.
Oh yeah. I still have to kind of pinch myself when I realize that Pennsylvania might be the leading state in the nation on research.
We are.
Yeah, that is really amazing.
Pennsylvania did that right for sure.
Yeah. Well, we do have a microphone set up. If anybody would like to step up and ask some questions, we'll be happy to entertain some questions from the audience here. I have some more questions for anybody that would like to take a shot. If we can grow our own, will that cut down on medicinal sales, or does it have no more impact than being able to brew your own beer has on people going to a bar? Anybody want to take a shot at that one?
I mean, I don't want to project, but I think in theory you would assume, depending upon how many people avail themselves of home grow, what's the rules around home grow, meaning the amounts that can be, because I don't see enforcement necessarily coming into folk home trying to measure if they had 6 plants versus 7 plants. I think it will be minuscule versus what the market, depending upon how we set up the adult use market in general, will have on medical side. So I don't see the home grow itself being the thing that will automatically depress the medical side.
Okay.
I don't believe it will. I haven't seen any evidence in the past where when they made liquor legal or anything else legal, it depressed the market. Consumers are going to be consumers, and consumers spending and buying, we already understand where that's at. Convenience is always number one. That's why you got convenience stores. So if you got if you're a consumer and you know that you have an opportunity to either grow it or buy it, in the nature of time, I'm going to go buy it, because to be honest, they could do that. I mean, there are some people that grow right now. Let's be honest, we ain't naive. But if they want it immediately, they're not gonna wait for it to grow. They're gonna go buy it.
But also, if you're not a really good grower, if you're not an experienced
You're not gonna do
grower,
it.
you're not going to get
It's
anything
really
close
hard
to
to grow. It's
at
not
the
easy.
level that you can get
Right.
it in the dispensary. And
But
I
it
think
al-
that's
But it also depends on the price too, though.
well, exactly.
The price will drive people to different markets. I mean, part of our motivation is to try to break the illegal market of the two. So the way we come about with our adult use from a taxing perspective will have major implications in a lot of ways. So
yeah.
Breaking it would be great, and I agree with that. Jake's right there. We could try to break the black market, but the truth of the matter is, we would have to reduce the cost a great deal in order to deal with the black market. Because at the end of the day, we already know what the black market is set for. So if we got a benchmark to understand how much we got to bring this product down in order to eliminate the black market, that's going to be where you have a struggle, because the black market can continue to drop price. That's going to be the number one problem that you're going to have. And that's why I tell people all the time, in this market, they still got, last time I checked, they still got, you got people, I'm trying to think of his name. It'll come to me. But anyway, you got people still doing beer, still selling beer out of their home.
Oh, yeah.
You know what I mean? Exactly. So you still have that. You're not going to stop, but you're not going to have as much of it. Because the truth of the matter is, legalizing it does one thing that I think is great. The synthetic marijuana is tearing our children up. It's tearing young adults up. It's making us look like we're not doing our job as legislatures to try to make a product as safe as possible. Legalizing that give us this opportunity. The medical marijuana versus recreational marijuana, that's a conversation that's not a problem. It's a great opportunity that we can have to create two great pathways. But the reality is, first let's get it legal so that we can make sure that the product that we have is the correct one.
Very good, very good. Gisele, do you want to chime in on this one at all?
I mean, Pennsylvania, agriculture is our largest industry. There's
yeah.
no reason why we shouldn't be leading as one of the
That's true.
states.
That's true.
doing that.
So we've got some people that want to ask questions. Go ahead, ma'am.
Thank you. I have too many questions, so I better narrow it down. I'm a respiratory therapist. I certainly see a lot of patients with inflammatory lung disease. A lot of times you're looking at obstructive lung disease. And if you take a look at the way that our healthcare reimbursement system is right now, because of the model we have for ACA, and it's not single payer. Well, advertising is driving it all. You can't watch TV without a commercial. Ask your doctor, about such and such. And so anyway, the question I really had is how single payer healthcare system may affect the affordability and outcomes. I know this is great research, and I thank you all for talking about it.
Thank you. Great question.
And the only other thing I wanted to know is, out of the 1,000 in Pennsylvania, are these primary care doctors? Are there specialists? Because pulmonologists don't tend to go along with this.
Yeah, both. A lot of specialists.
A lot of specialists.
Yeah.
All right, thanks.
Yep. Anybody want to pick that up?
Well,
How will it
no,
be?
unless I'm missing something, until the federal, this cannabis is made legal federally, the insurance is not covered under the insurance. So even and definitely not under a federal program, it wouldn't be covered.
What about if they take it off of Schedule 1?
Well, if they take it off the Schedule 1, potentially it could be, but right now, I would say is not. And so until we have, now it looks like the feds are moving towards, one, recognizing it and potentially allowing the states to continue to do what they're doing, and potentially this will become maybe off of Schedule 1 drug, but right now it's not covered under any other insurance, and that's part of the challenge.
And do the number of states going to legalization have bearing on whether or not that goes off Schedule 1?
Only if their members of Congress listens to them. And we just recently took a look at the number of states with senators, the number of legal states with senators. Of course, that's at 20 now. And then potentially you're seeing 26, maybe potentially growing to the number 26. So you could potentially have, with the House Rules Committee chairman just saying about the federal, recognizing the banks to be able to involve themselves into this industry. You have several other bills coming down. You have all the Democratic candidates saying we should have full legalization. I think it's within our next 2 to 5 years, you're going to see this whole industry kind of become a different industry because the feds will recognize it as a legal industry.
We actually just created, just a few weeks ago, if you go to our website, americansforsafeaccess.org, we wrote a briefing book for legislators, and in the back of the briefing book, we created federal legislation for the Office of Medical Cannabis. We created this new system that could regulate medical cannabis at a federal level. So that's what we are hoping for.
And then all this conversation changes dramatically if that happens, right?
does.
I mean, we're still kind of plodding along with state by state, county by
You do have to
county.
remember that even though it's legal in the state, you are still using a federally illegal drug, which means you don't have those federal protections.
And if it was legal federally, that would also take care of some of the medicinal problems of, having people who can cross state lines with their medicine.
Travel through
Yeah.
state to state is so important for patients. Can you imagine not ever having to leave your state because you can't? You need your medicine.
Or you
so.
just have it shipped to your house, even. You know?
You can do that either.
And Stan, before you move, but I think that's one of the reasons, at least from my perspective, why I keep stressing, as Pennsylvanians, we need to move on a program that we think fits us instead of waiting for the federal government to create a program nationally, because then we'll have to deal with a national reaction instead of having our program in place and fighting to make sure whatever the feds put in place fits into what we're doing. And so I think that's why it's critical not to wait. You hear some of my colleagues saying, well, let's wait to see what the feds do. Well, I think that'll put us at a disadvantage also from a growing and from a production, because I think we could have some advantages here in Pennsylvania if we were to move accordingly. So that's my little take.
Absolutely. Okay, who's next?
Hi, I am a proud card holder. So mine is for PTSD, and my question kind of comes from keeping the medical separate, is there still going to be more conditions added on, like the general anxiety, the ADHD? Is there still going to be more of that added into it? Or is it going to stick cut at the 21 qualifiers? Because
Well, they're still the Department of Health is still adding and discussing of adding new illnesses and diagnoses to their list. And I'm assuming one of the things we will be potentially talking about is moving. If we were to have an adult use, we think you should have kind of what my other panelists just said, having a cannabis type overseeing body. So take it from the department, even the medical side, and the adult use into one overseeing department, kind of commission, kind of like we have for liquor control board. You have like a cannabis control board where they specialize in cannabis industry, and then some of those things will be a part of their discussion.
We really think that there shouldn't be a list. I mean, it should. You can have a list, but like what Maryland does is it also has or anything that a physician recommends. And so that would be a great line to just add in there, like, sure, you can have these conditions, but then also, if a physician, there are so many just rare conditions that few people have that they still need this medicine for. So it would be great to add just, or a specific condition recommended by a physician.
It really seems like the most logical thing to do. Yeah, just leave it up to the doctor entirely. Yeah,
Okay.
yeah.
Now, going back to eliminating the stigma, I have a 3-year-old and a 6-year-old. I would much rather my children see me having the marijuana than having the pills. Now, they're going into the schools, and the stigma in the school districts. And you're going to start having children going in on the tinctures that are a mix. How are we going to work with educators? I'm worked in education. How are we going to work with educators, especially to eliminate that stigma? Because these kids, instead of going in on that medication, I've seen what that medication does to those kids. It bothers me seeing them on that. These kids are not eating for days on Adderall, and how are we going to get with the teachers? Like, we were talking about further education, educating professionals, educating teachers, how are we going to address some of those issues
So I know
to get rid of the stigma?
I know I've been in discussion with some of my cannabis education learning centers, and they have asked to have some meetings with some of the guidance counselors, some of the career and technical educators inside of our school system, because they want to come from a standpoint of a workforce development thing. They not so much about the utilization, more from trying to change it from looking at it as a negative and looking at it as a career opportunity for many of these students to go into, to learn about, to produce in a better way. And so we've been setting up some small conversations with them. And I'm assuming if you're once you start having those type of conversations, it's a natural to then to start having the other conversation around proper utilization and what these things could be used for, and again, breaking down stigma by, I think, educating and communicating.
I'm sorry, there's a move to get school nurses to learn how, or to be able to be caregivers in order to be able to. Debbie, do you know of anything that's happening in
New
Pennsylvania?
Mexico, right? New Mexico just recently passed something for in schools. I think that is such a great question, and you're right. We need to focus more on. Usually, what happens is it doesn't become a problem until a child goes into a school who is using medical cannabis, and then suddenly is everybody like, what do we do? And then they figure out a plan, hopefully that works. But we should be proactive, and we should really start educating teachers and school counselors and school nurses, and it's a great outreach program that I'm going to look into now.
Thanks.
Go ahead. I'll let somebody else.
Hi, panel. Thanks for being here. I think the first
You gotta get
thing
right
I
up on that mic. Yeah, there you
There
go.
we go. I think the first thing I want to say is it ain't nobody's business if I do. And on a federal level, I think personally some of those people need to get high with their idealism. One of the questions you answered, that you have 1,000 physicians on board, and so that's encouraging. And then you're going to have plenty against it. As one thing you mentioned, the possibility of abuse on the job. most likely you're always going to have a percentage of people in any level of, with alcohol, whatever, that's going to be abused. I'm associated with the medical field. I've seen physicians down to the other end of the spectrum that were busted for abuse. So you're always going to have that.
Do you have a question?
I think that I don't understand why everybody drags their heels, because it's you have the alcohol situation that can be so out of control and very detrimental to people. And I think it's a responsibility with society that if you're going to legalize marijuana, you have to be sensible about it and not abuse it at where you're not in points. So with the physicians that you have 1,000 on board, these are promoters of this?
It's kind of across the board. From my contact with physicians, you'll have some that are very pro. You'll have some that have Suboxone clinics and just wanted to be able to certify their patients.
Right.
There's also an option that the doctors can opt out of being on the list. My own personal doctor didn't want to be one of those doctors.
Right.
Like one that cures people from pain, apparently. But those are the 1,000 doctors who put themselves out on the list.
Right.
So, and they are across the board, but also across the board, the spectrum of, they just did it for the convenience for their patients, and some are actively making it a part of their business.
And what's Peduto and Wolf's point of view or stand on this?
Anybody know?
So Mayor Peduto has come out publicly in the past supporting legalization of cannabis, adult use. The governor has said that he believes we need to study the issue, and part of I think the lieutenant governor's tour and the responses from the citizenry will feed into his further knowledge of this situation. I think he's open to the idea. He said to me personally, if I can get him a bill to his desk, he would seriously consider it. The question is, can I get a bill to his desk?
Right. Okay. All right. Thank you very much.
Yeah.
And I think that's, I want to point this out since we're talking it. On April 29th in Harrisburg, we're having a public hearing on decriminalization and legalization of cannabis. And the reason why we're doing it is just what Rep. Wheatley said. Sometimes we got to take the truth to them. And so we had decrim and legalization forum in Philly, and we had one in Pittsburgh. And very good. But now we need to have one in Harrisburg. And we need to get some doctors up in Harrisburg that can testify about exactly how the municipals work, how great it's been, and get people to understand that even from a doctor's standpoint, they are saying that this right here helps. There's enough evidence out there that helps. Here's the problem. People that's been lied to since 1937, and it's been generation. It's so deep in them that even if you give them the truth, sometimes it's hard to accept it. But education is repetition. The more you educate, the more you repeat, the more you repeat, the more you know. And we have to constantly remind people of why we need to change these laws from a patient first point of view, a criminal justice second point of view, and a tax point of view, and how we can reform a lot of errors that we made through making this illegal. We have an opportunity to do all four of them, but it's up to us to continue to educate. And that's why I'm looking forward for April 29th in Harrisburg to have this public hearing.
Oh, okay. Just a quick question. When will medical patients be able to write their medicine off on their state and local taxes?
Ooh, good question. Debbie, does any state allow that?
No, I think it has to be federally
Oh, it has to be
legal
federal.
first.
Okay.
Yeah.
So we're still talking about the federal.
Yeah, I wasn't talking about federal, but yeah.
Yeah.
Thank you.
Yeah. So we got one more coming up.
Hey guys, how's it going? My name is Felon Barrero, and I work as a consultant in the cannabis industry and media as well. I just wanted to first thank you guys for all the hard work that you've done. You know, we've seen a lot of progress here in the last year, 2 years. I remember 2 years ago when SB3 was being worked on, that's when I met some of you. You know, I heard a lot of pessimism that, you know, they said it wasn't going to pass and all this other stuff, and now here we are. So I just want to thank you for all the hard work that you've put in. So I guess the issue that I want to talk about a little bit, I just want to ask you guys about, is have you noticed that the stigma and a lot of the things a lot of the obstacles that you're coming up against are due to the fact that you don't really have a clear separation between what constitutes medical cannabis versus recreational cannabis, you know? Right now you have a situation where, let's say you legalized recreational tomorrow and gave somebody the opportunity to open a recreational dispensary. What is the difference there? Now, in states such as Las Vegas or in California, Las Vegas, we'll use Las Vegas, because anybody can just go there and, you know, you walk into a dispensary and if you have your card, they have a separate line for medical and they have the line for recreational, as you spoke before. But, you know, doing consulting for manufacturing companies, one of the things that I've been advocating for is not that pharmaceutical companies don't have control over the industry, but rather that they're making their pharmaceuticals cannabis-based and cannabis-derived rather than using these poppy and things like that. And when you start to look at the industry from that perspective, what you see is, you know, it's a little confusing when you're going to, you know, you're a patient and you're going to buy, you know, plant matter as your medicine. You know, like you're not going to a pharmacy right now and purchasing fungus. You know, you're getting your penicillin, you're getting your Tylenol, your Advil, these types of things. So I wonder why we're not taking that kind of an approach. You know, if we're going to move forward here, why don't we look at the future and say, okay, well, in the future, medical cannabis doesn't actually exist. In the future, what we have are pharmaceutical companies that exist the same way they do now, giving us cannabis-derived medicines through pharmacies. And the recreational industry, you know, everybody that uses the dry cannabis, they're medical patients whether they know it or not. You're still going to get the effects regardless. So your reasoning, as this gentleman said here, the reasoning that you're using cannabis, it's your business. It's not really the government's business. Wow. So I think that moving forward, and to shut up because I'm long-winded, I think that we need to just make sure that we take a look at what the future is going to hold once common sense takes place. And what we're going to see is if you want to smoke or vape or, you know, eat some candy or gummies or whatever the hell, you know, you're going to go to what would be basically a liquor store or a dispensary for these types of products, and your whole entire medical program should be based out of a pharmacy. That's my only 2 cents I'd like to say.
And that's the way they do it internationally. And we've been looking at that model as well. The truth is, the way the United States works right now isn't perfect. It's what we needed at the time. Like you're saying, I'm not going to wait till the federal government makes it legal for us to move forward, and you shouldn't, because patients need this medicine. So unfortunately what happened was all these states are doing it all these different ways, and that's not the perfect way. And we kind of do need to think about what would be the perfect way. But also, you know, people that use it, we like to say it's a spectrum of therapeutic use. So some people are using it to relax or to sleep. That's a form of a therapeutic use, you know, but there's also people using it for cancer, for MS, for epilepsy. So there really is there's no like medical, recreational, it's all kind of a spectrum, and it depends on where you are on that spectrum.
Actually, about that, that's kind of what I'm talking about, actually, is, you know, let's say there are patients that use it for MS and cancer. Why are they smoking instead of getting actual concentrated
Pills.
stuff? Yeah.
Right.
So, you know,
Right.
not necessarily
Pills.
just
Right.
the pills, but whatever that is,
Right.
that, you know, syringes, anything that they have there. Like, these are actual medical products. So, you know, I'm not
Right.
saying, oh, I've got lung cancer or, you know, MS, let's go smoke some joints, which, you know, whatever, that works for you, that works for you. I'm just saying, you're right. That's where the separation needs to occur. Is, let's say you have MS, you're not going to go to a dispensary and get plant matter. You're going to go to a pharmacy and get
pills,
these
tinctures,
types of
oils,
things that you're used to. A doctor
that's-
can prescribe these things without the
Right.
stigma. People can use these without the stigma. Nobody's going to look at it. And then, you know, whatever stigma's attached to cannabis use just goes to the recreational industry, and we'll deal with that, you know?
So you think all plant matter should just be, by definition, recreational?
Absolutely available in a recreational
And then
facility.
anything processed?
Everything
from the
processed that's
plant.
Some
not
people need
flavors
to
and things like
smoke
that.
it, though. Some people, it's the quickest way to get into the system. Some people need to vape it. Like, literally, there's people that are, like, they feel they're about to have a seizure, and they vape real quick, and it goes away. Like, so
That's true.
there's
And-
definitely people need
No,
flower.
you're completely correct.
Yeah.
But what I happen to know, well, not I don't mean to say it like that, but what I happen to know is that there are pharmaceutical products that are
Right.
full spectrum. So right now we're doing the research,
International,
and we
yeah.
can bring you these products to our patients without it having to be that way. So although yes, you can, smoke it or use it, however. For example, anxiety patients can go to their pharmacy and buy the cartridge right there. And it's not going to be a cartridge that's, got bright, flavoring and all this other crazy stuff where it's just a THC distillate and some carcinogenic terpenes in there, and it's because it tastes like a vape. Instead, it's going to be the full spectrum. You've got all of your readouts and everything like that, the same way you'll get it, but it'll just be from the pharmacy. I don't know. It just seems to make sense. But I understand you.
I would say that I'm open to all ideas. I think, but one of the things when you start talking about the pharmacy, one of the things, irrespective of what we do on the adult side, I mean, I do think that we should treat all of our medical-derived institutions similarly. And when you look at our regs around the pharmacy side of things, we are less stringent with them than we are with the medical side of our cannabis industry. And I'm not sure if that's right or wrong. I just think that if we're going to attack this stigma, then we should treat CVS's of the world the same way we treat the cannabis-related medical facilities. They should have the same security concerns. Now, I know that they are a little less intrusive from a federal stance, but they should have the same security requirements. They should have the same ways of identifying and treating patients. I think so that way we will take some of the stigma out, and then all of these facilities will be looked at in a similar vein. It wouldn't be looked at as, oh, I'm going over here for my cannabis. No, I'm going over here for, like you said, I'm going over here for my medicine, and I'm going over here for whatever else. So we are looking at ways to do that. Now, I know there's a lot of pushback on that because, it would cause some physical changes to happen in the way we view the CVS, the Rite Aids, and all of our other pharmacies. But there's just as many things that happen inside of that to get medicines on the street illegally.
She's back.
I'm back. And yeah, I use it for PTSD. And if I'm getting ready to have an anxiety attack, I can't wait for an edible to kick in. Like, I need to smoke. I need to vape. I don't want to have a panic attack and break down in front of my kids. I'd rather them see me smoke. So, and then just keeping the pharmaceutical companies out of it altogether. I don't think the pharmaceutical companies need to have their hands in the medical marijuana field whatsoever. I'm sorry. I know they do already, and it's BS. I think it needs to stay within the state, grown in the state, keep the money in the state, use the money in the state, instead of letting some pharmaceutical company have it and take it to DC and put it in somebody's pocket. Okay, I'm not gonna rant on that, because I could easily.
Because Debbie's here from DC.
But what if you want to travel out of state with your
Yeah, and
medicine?
I live where I live most of the time. Whenever I go home, I go through West Virginia because my property borders West Virginia. And I didn't think about it a handful of times coming home from the dispensary, and right there, I cross state lines. And I wouldn't even think about it. And I'm in Paris, Pennsylvania. I'm in Burgettstown. I am like the furthest point out possible. And for us to get to the dispensaries and everything, like, would the legalization bring more dispensaries around the area? Because I have to travel like at least an hour. So would it make it more available? And I don't want to lose the interaction to be able to go and talk to somebody and say, okay, these are the terpenes that are in it. This is the cannabinoid breakdown. It has this, like, I like the 1-to-1 ratio, the Harlequin that Cresco does. And stuff like that. I don't want to lose that whenever legalization comes in. So how is that going to be?
And that's really the whole crux of what we were talking about
Yes,
today,
like
is to make sure we don't lose that. So we're not going to lose that and make it more available because, okay. Yeah.
Okay.
Yeah, I hope you're not going to divide the medicine to make it, flower not available for patients anymore.
No,
so.
that's.
Well, this actually, there's a a point that's been kind of talked about a little bit, and I'd like to get everybody's opinion on this, and that is the idea that all cannabis use is essentially medicinal in nature. We all turn to this plant because of the need to relax or something else. Gisele, why don't we start with you? And what do you think about that idea, that all use is actually medicinal use?
Yeah, I mean, sure, you can view it like that. But I think it's really important to not lose one for the other.
Right.
And do it the right way. With equity being at the forefront of that, the medicine is really important, but we've destroyed lives. And we continue to destroy lives. How do we stop that and make it right going forward?
From a social justice or from the impact on the totality of society, I think you have to say that the criminalization of it, the putting in jail of people, especially people of color, it's essentially been used as a weapon to attack your community. That's got to be the biggest thing that has to change. We're pretty much all in agreement on that.
No question.
Yeah.
When you just think about just the war on drugs in general, that's what I try to explain to some of my colleagues. If you take 30% of men out of a community, generation after generation, you set up a family for failure. Because there's certain stigmas that are negative stigmas, but in certain communities, they become highlights, right? So, I was raised in the Hill District in Homewood, and there was drug dealers that always took care of certain things in our community, and they were looked up to. And whenever you hear the stories of them, it's never in, oh, they messed up. It's in revere, like how great they were. So you got a son that is hearing about how great his daddy was and learning that line of work. That son ends up going into that line of work. And in some cases, you got 3 generations. And now you got 3 generations in jail. But we use drugs the same amount as everybody else, but the penitentiary looks like me. It's the same thing that we're talking about when we talk about growers and dispensaries right now. It just can't be, and this is what we fought for with medical marijuana, to drop the price down to make it more advantageous for people to get in. But if we don't diversify the economy, then we haven't done nothing to aid criminal justice, even if we stop people from going to jail, which is a great thing. But for the same thing that they gave time to, if time is money, they should have a right to be able to make money in this industry as well as own a dispensary, so that the time that we took from them, we can give them back. So when they're revered in the community, they're revered in the community for something positive that's legal and not illegal.
Absolutely, absolutely.
Well, I'm going to chime in a little differently. I think we do need to separate it, even though they may be the same continuum. I think parts of this continuum, because a doctor is working with you to kind of help you deal with whatever is ailing you, versus when I wake up in the morning and I just feel the need to do something that I personally want to do for whatever it is. I think we need to treat them differently. I think we need to regulate them differently. And again, I think that is in line with how we do all our other medicines and all our other products out there for adults to choose to indulge in. And I don't think this is any different. I think this is another product to offer citizens. Some of it is for medical, and some of it is for your own personal choice to use, just like with our alcohol, just like with our tobacco, just like with all our other products. And I think we should treat them differently.
And I agree that I think the second lady of the state and Representative Wheatley said it great, that we do need to treat both of them differently. Because if you got stage 4 cancer, that you need to be in conversation with your doctor about what you need. However, it also holds true to the question you asked, for those that's been doing it recreational, are they receiving municipal benefits? The answer is yes. Because if you ask some veterans that have been smoking cannabis for the last 50 years, 30, 40, 50 years, because of their PTSD, they're going to tell you they smoke it because they would rather smoke that than taking the opioid pills because of the municipal benefits that they get from it. So the answer to both is yes. It's not that the answer is yes. The reality is if you're in a situation where you have an illness that you need to be under a doctor's care in terms of what you can take that can help you eat, that can help you function, that needs to remain intact. But that also does not mean that this is not true over here. It's also true that when you use it, you're also getting municipal benefit.
So what I'm hearing, I think, from everybody is that there's a clear desire to make sure we protect our medical industry. And we've got an expert right here who we can all make use of here to find out what are the best practices. So I'm glad you guys all met Debbie here because she's quite a great resource for us. And Mrs. Fetterman, what has been the overwhelming, or what has there been an overwhelming outpouring? Watch on Facebook to see your husband's tour and how it's going. It seems like most of the groups that meet with him wind up being mostly positive and mostly pro.
Yeah, and I'd love to invite Julie if she can add to that. Julie is Lieutenant Governor's Western PA person. She's attended many of these tours with him.
That's true,
So
yeah.
she'll have kind of a first-hand.
She's the one that takes the pictures of the videos here. Yeah.
Okay. Hi, can you hear me? Okay.
Yep.
So across the board, the listening tour has been really well received. Whether folks are pro or con, it's been a substantive debate. And the overall, so far on the tour, we've never had a room that leaned con or against legalization, but we will be determining all of the numbers and the data at the end of the tour. We're going to all 67 counties in the Commonwealth. So we have multiple ways for people to weigh in. At every tour stop, we do a show of hands and record that so that we can read the room, whether it was leaning pro, con, or if people are unsure. People can also weigh in online with their opinions. And at every tour stop, we also have comment cards that we collect and document per county. So at the end of the tour, we'll be going through all of the online comments, reviewing all of the video and the in-person comment cards. And then that information will be given to Governor Wolf.
Excellent. And what of the objections or the concerns that people have, other than the ones we know are kind of nonsense, have there been any concerns that you think are really valid that people want to know about?
There are folks that have had concerns about their guns being taken away. That's one. And then we also have folks that just don't understand or just have questions. I wouldn't even say that they're so much against, but they have questions about what the legislation would look like, what the real impact would be in their communities. And those are all valid concerns and questions. We also have people that are concerned about, even if it's adult use, if children would be able to get access to it in their homes. So I think there's also a huge piece where people can be educated. And again, that's been a sentiment echoed on the panel. And I think it's great for people when they come out on the tour stop, even if they're against, even if they have questions, to hear everybody's perspective and to get information from other people that may be more knowledgeable about the subject.
Great. Thanks so much. So we're going to wrap it up here. I'd like to just go down the line and have everybody give any last thoughts. Is there anything that we haven't talked about that we want to talk about, or any points that you want to make sure are really emphasized? Representative Wheatley, start with
Yeah,
you.
so I lead off most of my conversations around this rationale for why I'm doing what I'm doing with HB 50 with just a small, brief historical overview. In my opinion, the cannabis should never have been made illegal. And the only reason that it was made illegal was to further subjugate a population of people, and most of black and brown people. And I used my evidence starts in 1970 with Schaefer, former governor of Pennsylvania, who was commissioned by then President Nixon to look at this drug to see what negative benefits may be to society. The commission did its work, came back and recommended to the Congress then and to the president that cannabis should be treated just like alcohol. It should not be criminalized. And if you wanted to prevent people from further using the plant, then you figure out social ways to educate them of his social ills, but it should not be criminalized. And Nixon, in his wisdom, took that report and basically shoved it in the closet somewhere and used fear and hate to then target black and brown communities all across the country. The beginning of the mass war on drugs. And so if we are ever going to get serious about where we are as a country and where this drug fits into our failed drug policy, then we should be real serious about where it comes from. It was never a drug that should have been on the Schedule I classification list. It has medical benefits. And so we need to get serious about how we can then now redirect some of our energies and some of our failed policies to do better in this next century.
Here, here.
Sure. I just want to thank the efforts of everyone on this panel and for you hosting an event like this to allow these voices to be amplified.
Thank you so much.
I agree, and I want to thank everyone for sharing their stories too, especially you, because it really takes courage to say I'm a medical cannabis patient with the stigma still going on. But I also want to encourage people so my organization, Americans for Safe Access, we've been around since 2002. We've been doing education research. Feel free to reach out to organizations like myself, and granted, we're just a medical cannabis group, but we know a lot of educational resources, and so feel free to reach out to organizations like myself.
Fantastic website, lots of great information on there. Really, especially about how to start that conversation with your doctor. Really good information. So I want to second that notion right there. Representative Gainey?
I just want to say thank you. I thank all of you. I appreciate being here today. And more importantly, we got to look forward to this battle, right? I mean, we knew it was going to be a battle when we started down this path. So, they said we couldn't get medical marijuana done. So I'm looking forward to legalization. I know we can do it. If you get a chance on April 29th, come to Harrisburg. Come to the public hearing. Come here. You had a Senate there. You had a House there. We're going to have people testify. And because the reality is, again, we have to continue to market until we win. One thing about the medical marijuana moms, that's what I call them, they would sleep in the Capitol to get it done. That's not support, that's commitment. And as long as we're committed to making sure that we got a better lives for humanity, we'll be all right. We just got to battle, that's all. So I just want to say thank you.
Thank you. Thank you.
And I would also I'm just going to remind people, just recently this week, the Rules Committee Chairman, the House Rules Committee Chairman just said that there will be advancing a bill over the next couple of weeks that basically will protect states who have gone to legalization from federal intervention.
Yeah, and another thing, I don't want that to be the narrative, right? Because to be honest with you, here's how I know at some level the feds are going to move. You have too many states legalizing. You got every movement that's happened in America has been state driven, and what you're seeing is you're not seeing nothing different right here. We're on the right part of history. The question is not if, it's when, and that's why we got to continue to drive the narrative. Not can they come in and close down. How we gonna make them open it up?
I just want to say there is a thing called the CGS Amendment, which protects states from the federal government coming in right now, but it has to be voted on every year, and that's one thing that we advocate for, to make sure that gets voted on every year. And that protects from federal government not spending any funds on coming after state programs.
Well, as you can see, this is a conversation that can go on for a very long time. But we're going to wrap this up. Once again, let's give a big hand to our panel here. Thank you very much. That concludes this episode of the Dispense Magazine podcast. We hope you enjoyed this discussion about what happens to our medical program if adult use is legalized. Join us again on our next podcast when we talk about this very same issue with the author of the Senate bill now under consideration, Senator Sharif Street. You can find that one and all our podcasts on our homepage at dispensemagazine.com. I'm Sven Hosford. Thanks for listening. This podcast is a production of Mindful Medicine, LLC.